Hi everyone, I'm Dr. Afrin Rajai, and today we are going to talk about solution-focused therapy. SFD was developed by D. Shazer and Kimberg back in 70s, and the quotes that you see here in this picture, I think it's a way of, having a summary of the whole approach. Problem talk creates problems, solution talk creates solutions. As it sounds, solution-focused therapy does not focus on the problem. Its focus is on the solution. And this is just this slide is a funny way of, thinking and considering problem-focused versus solution-focused, and how our perspective, our mindset, even like the language that we are using and talking about a situation could be different in those two different perspective or approaches. Solution-focused therapy is a very hope-friendly kind of like approach. In solution-focused therapy, the whole therapy and the sessions and the conversations, they are really focused on the future. So it's future-oriented instead of, focusing on the past or the problems or, what happened in the past. So with that direction of kind of like looking at situations, that having that, hopeful future-oriented perspective, motivation, and setting up goals that are achievable, achieving the solutions and those goals, they are really important. The other thing that happens in solution-focused therapy is that the therapist really wants to advocate for positive emotions and, increasing those positive emotions in the session in client's story. Given what was mentioned in the previous slide, solution-focused therapy is linked to motivational interviewing and a strengths-based perspective. I think this later part, strengths-based perspective, it's really important, and we need to give more credit to solution-focused therapy to kind of highlighting that in therapy and, in clients and people's life. And other approaches, they also got inspired by this positive direction and hopeful and strengths-based direction in clients and in therapy. A lot of times when I see clients, they come to therapy and they talk about all these negative things that they know about themselves, kind of like even like self-diagnosis that they had for themselves. And when I ask them where do they come from, they say, I'm listening to this podcast, or that psychologist on TV, or whatever, and then I realize that I have XYZ, even like the terms from the DSM, right? So they talk about all these different things, and when I ask them, okay, all these things about yourself, how are they helpful for you, right? What are their functions? What are their usefulness in your life now that you know that you have OCD, XYZ, right? And usually a lot of times they don't know what to say. So actually, like talking about strengths and helping clients discover and rediscover their strengths, and talking about them, the resources that they have, and how resilient they are. It seems easy, but sometimes actually it is not easy, and it's difficult to do it genuinely and very authentically in a session. So again, like this strengths-based perspective in solution-focused therapy, it's really invaluable. Now let's talk about some tenets of SFD. So as you know, similar to other postmodern approaches, SFD has this perspective or assumption of not assuming, right? So you go to a session as a solution-focused therapist, and you do not bring your own assumptions to the session about clients or what the problem is, what the solution should be, all those different things, right? So not assuming is one of the main tenets or core tenets of SFD. The other tenet is about if it's not broken, do not fix it, and if it works, do more of that. Basically, again, it has to do with that focus on solution and not focusing on the problem, right? So if something is not broken, if it's not a problem, we do not need to focus on that to make it a problem and to fix it, right? And if something is working and it works out, then you can do more of that, right? This is really helpful, keeping that in mind, because as we move forward, we're going to learn about some of the interventions and techniques in SFD, and these two, number 2 and number 3, they are really helpful in some type of the questions that we ask in SFD, and some sort of techniques that we have here. The other tenets is about looking for exceptions, and again, this has to do with one of the interventions or type of questions that we use in SFD or solution focused therapy. So basically in solution focused therapy, because our focus is very future oriented, and it's about kind of like creating the future and negotiating the future, right? What we want to see more in the future, right? And what we don't want to see in the future, right? We do not focus on the problem, we focus on what we want to see more in the future. One of the things that solution focused therapists do, they look for exceptions, right? So for example, when a client is talking about depression and they call themselves that I'm a depressed person, I have depression, all those different things. When you ask more questions of them, for example, you can ask a question about, is there a time that you feel like this depression that you're talking about, it's like less in your life? And then they tell you, yeah, when I'm at work, the 4 hours that I'm working in the supermarket, I feel like things are better and I don't feel, that depressed. Then that is an exception, right? So, okay, so when you're at work, it seems like the depression is not there. So, and then when you go back home, you feel like you are down. So those kinds of things could be an example of looking for exceptions. Then it's also about asking questions rather than telling clients what to do. And this is one thing that I'm going to talk more at the end of this lecture about some of the mistakes that therapists do with solution-focused therapy, because when we are talking about all these different things and the focus on solution, sometimes there's this misunderstanding that solution-focused therapy is about having a solution, kind of like having an instant prescription in your pocket, and then whenever a client is talking about something, you just provide that prescription to them. And that is really not what solution-focused therapy is about. It's more about asking questions and helping clients using their resources and using their strengths and the abilities that they have in their lives. We already talked about future oriented and the fact that future is negotiated and created in solution focused therapy. In solution focused therapy, if you watch some of the sample videos from the pioneers, you see that there are a lot of compliments in the session. And one comment that I have on that, like most of the other lectures that I had, and I usually mention this, that you cannot fake therapy. So all these different things that we are talking about here, including compliments, you cannot fake them. You cannot just say something positive and think that that is solution-focused therapy. Whatever you say or you do in a session, it should be really authentic. It should really come from your belief about human beings, change, strengths, problems, solutions, all those different things. And then the compliments that you give clients, you really need to be present with saying those things, and your body language, your tone, all those different things, they should be aligned with those compliments. The next thing is that in solution-focused therapy, change, the assumption is that change is constant. So the only thing that is not changing is change. So you always have change, and human beings, they can always change, and it's always possible to have that change in their lives. The solution is not always directly related to the problem. So for example, when a client is talking about anxieties, and anxiety is sort of the chief complaint why the client is in your office right now. When you have the different conversation and when you ask different question, you may realize that when they are with their family members, when XYZ happens, they feel much better. So the solution may not be directly related to anxiety. For example, okay, you feel anxious, so have a deep breath, right? Or do the journaling or stuff like that. It could be, slightly indirected from the problem. And then lastly, what I already mentioned, everyone is capable of change, and change is constant. It can happen all the time. Therapeutic relationship in SFD is really, exciting, and it seems exciting and warm and hopeful, right? Based on all the things that we have talked so far. And that warmth and excitement and hope is really helpful in terms of shifting the hope, or twist, what they call, twisting the hope in the session towards a more positive direction. And it's actually really, really powerful. And sometimes when you just look at the world with everything that is going on in our world, all these different sufferings, the negative aspects of the environment that we grew up in, right? All those different things. This shift sometimes really seems the change that we need in our lives, right? Which includes, clients' lives. And again, I think that it's very powerful, and there is glory in having this type of therapeutic relationship. But one thing that again I want to emphasize is that this cannot be fake, right? So in order to have this excitement, warmth, hope in your relationship, therapeutic relationship with your clients, if you are a solution-focused therapist, you really need to live by, the assumptions or the tenets of the theory or approach. Otherwise, it wouldn't be as authentic, and it wouldn't, and clients, they can see that. In solution-focused therapy, similar to many other approaches, goals should be meaningful to clients as well, right? So that is why you, as the therapist, you do not have a, kind of like an instant prescription for clients and say, hey, this is your problem, here you are, this is the solution, right? So goals should be meaningful, and you really need to collaborate with clients in setting the goals. So for example, if you're working with a family and they come to you with all these different conflicts, they may tell you, hey, you know what, we really want to have a happier relationship or family dynamic, right? And that is something that it's respectful, it's nice, right? So it could be meaningful to them. But then goals also should be achievable and ethical and legal, right? Which means when they say we want to have a happier dynamic or happier family, then you can ask, what does that look like, right? So if you wake up tomorrow and your family is just so happy, you have this amazing family dynamic, what does that look like, right? And then if they tell you, one of the things that I want to happen is I don't want to have a fight or a conflict at all in the future. Then, as therapists, we just know that that is not possible, right? Or if they say, I want for my children to always listen to me. Whatever I say, like they say, yes, okay, ma'am, right? We know that that is not achievable, that is not realistic. So we want to work with clients to set up, achievable goals and realistic goals, and, help them having small steps in kind of like achieving the goals in their lives, right? So you want to have less conflicts in your relationship. Great, awesome. And when we say less, we mean maybe now you have 10 conflicts, 10 fights on a weekly basis. You want to have maybe 5, right? Or you want to have 7, right? So decreasing that from 10 to 8 or 7. It should be the goals that you set up with your clients always should be ethical and legal, including in solution-focused therapy. So if a client or if a family, they're in front of you and they say, hey, we want to have a happier, family dynamic, and then because of that, I don't know, something crazy. I think that if we have this sort of, I don't know, emotional abuse or verbal abuse or violence, I want to do XYZ so that we can have a better relationship for some reasons, right? Whatever. So if at the end of the day the goals are not ethical or legal, of course, as a therapist, you cannot do them or you cannot agree with them, right? And then obviously the goals are situational because we've been talking about them for 10 minutes or so for now, right? That we focus on the solution, on one specific situation, and what can you do so you see what you want to see more than before. So of course that goals are situational. Now let's talk about interventions. If you remember in the beginning of this lecture, I mentioned that solution-focused therapy is linked with this strengths-based perspective, right? And then I mentioned that other theories and approaches, they got inspired by this strengths-based perspective and kind of like hopeful perspective. The same thing is about their interventions and techniques. So a lot of techniques and questions that we use in solution-focused therapy, you will see in the future that other therapists, even like their approach is not solution-focused, they still use some of these type of questions or techniques just because of blending that positive and strengths-based perspective into their approach and into their therapy, and they are really, really helpful. So for example, one of those type of questions that we ask is scaling questions, and scaling questions is like you ask clients on a scale 0 to 10, or sometimes with percentage. On a scale 0 to 10, how confident are you that this is one of the problems in your relationship? On a scale 0 to 10, how confident are you that this hurts your daughter, your partner, right? And it's so interesting when you ask those questions, because a lot of times clients come to a session and they are so confident that their relationship, their life, their family dynamic, whatever, it's just horrible because of this problem, right? But then when you ask this question, they pause and they tell you, oh, on a scale 0 to 10, I guess it's 3 or 4. So it's kind of like a aha moment for them to realize that there is another way of looking at this as well, and it's not that big of a deal that I thought before. The other type of questions or interventions include exception questions, and you see some examples here. For example, what is different about the times when this is less of a problem? Are there times when this has been less of a problem? Just kind of different wording. What did you or others do that was helpful? And if it was helpful, when was the last time when something like this, client's goal description, right? Having a happy relationship, or, spending more time with my children, perhaps happened even a little bit, right? So if they're telling you, what, I have this, I'm the CEO of this company, I don't have 0 time to spend with my family, with my children, but I know that they are important, blah, 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 right? Then you ask them, what was the last time that, you spend, a little, like 1 hour, 30 minutes with your children, right? Even like for a little bit, when was the last time that happened? And then they may tell you, oh, it was, the last vacation that we had, it was like 3 months ago. And then you kind of like promote that. Oh, so there are some times, even like a little, but there are some times that you have the opportunity to spend with your, children, right? Kind of like you highlight that exception in their life, so you kind of like enhancing the possibilities for them, right? You are twisting that hope and that direction in their stories and in their lives. The other type of questions, again, as you see here, they include coping questions, pre-session change questions, and future focus question. So coping questions, an example of that would be, how have you managed to carry on, right? How have you managed to prevent things from becoming worse? Again, this is based on the fact that you really believe that clients, they have resources, they are capable, change is constant, so and everyone is capable of change, right? So you try to kind of like indirectly remind them of the times that they handled this situation by themselves, by the different things that they have done. Then we have miracle questions, and this is really one of my favorite questions. A lot of times I use it with couples. So when you ask this question, you're asking about what they want. You're asking about their goals in a specific way, kind of like indirect way. So you would say something like, imagine that asleep, when you go to bed, when you are asleep, a miracle happens, and then tomorrow when you wake up, you have this, whatever they're talking about, right? You have this perfect relationship, you have this perfect parenting style, or you have this perfect relationship with your colleague, right? So whatever they're talking about, what does that look like, right? So they start talking about it. Here's the thing, sometimes when you ask these questions, clients, they pause for 1 minute, and then after that they say, I don't know, right? And then again, as solution-focused therapist, it's really important for you how to respond back to that, right? How to ask the questions. You kind of need to walk with the client into that question. So if they have nothing to say, Then you ask them, okay, let's just think about like tomorrow morning. You wake up, and then what does that morning look like? What does your communication with your husband, with your partner, with your daughter look like? What does, the afternoon, kind of like breaking it to small pieces, so it would be easier for the client to go with that. Again, remember, as a solution-focused therapist, you are hopeful, you are warm, you really believe in your clients and in your families who are in front of you, right? So it's not like that they have nothing to say and you tell yourself, oh, they don't have any insight, or they don't know what they are looking for, no matter why they are here. The mind of a solution focused therapist, their mind, it doesn't work like that. So you are there to help the clients. You can walk them through the process, and you can ask a question in a way that would be more helpful for them. Pre-session change questions include, for example, you say something like, we have learned over the years that sometimes in between making an appointment and coming in, something happens to make things better. Did anything happen, or did anything happen in the last session, or between the last session and today, that you're here, that changes some of the things, some of the stories that we were talking about, anything that you liked, right? And then we have future focus questions. For example, what will you be doing in next week that would indicate that to you that you are continuing to make progress, right? Again, like it's aligned, it's shifted, the direction is towards their goals, right? That hope is infused in that question and the way that you're talking about it. So all of these questions, they can be really, really helpful in terms of having that conversation, creating that conversations for the solution. Solution-focused therapy is used with almost all ages and with a wide range of issues, including addiction, child behavioral problems, relationship problems, but it's not the best to treat major psychiatric conditions such as psychosis or schizophrenia. If you read different books or different articles, you will see that it's effective in different situations and different clinical situations. For example, decreasing addiction, severity, and trauma symptom, right? All these different things that you can read in the textbook and in different articles. Some common mistakes in solution-focused therapy is that sometimes therapists, they think that solution-focused therapists, they don't talk about past, they don't talk about problems, they don't talk about emotions, and they have kind of like instant prescriptions or solutions. All of them, they are wrong. Of course, that solution-focused therapists, they talk about past and the problem, but the point is the focus, the balance is not like that. They spend, 80% of the session talking about the problem or the past, right? So they talk about the future and the solution more than the problem and the past, right? The same thing about emotions. Of course that they talk about emotions. They address emotion, they have, the conversations about emotions, but again, like they try to not make it, focus on the problem or the past a lot. The same thing about prescriptions and having solutions and the conversations that they have. It's more about asking questions and then clients kind of like realizing what they need to have what they want in the future. In terms of diversity and culture, solution-focused therapy, because of that notion of not knowing and really getting familiar with the clients and learning about them from them, it's really adaptable and it's really aligned with diversity and culture in many different forms and layers. I think this is a really good practice for you to have for, not only CBT and CFBT or CFT, but many other approaches that, have something like this, a practice like this, and then compare the different approaches or theories in terms of definition, purpose, what they do, what they don't do, goals, therapeutic relationship, those kinds of things, because I think that it's a good practice, kind of analytic practice to help you understand and compare different theories. Thank you for watching this lecture and listening to this lecture, and I'll talk to you later in different topics.